Imagine going through life constantly hearing a static noise in your head, or not being able to turn off your racing thoughts while trying to go to sleep in bed, or even not being able to focus on things that you need to get throughout the day because they're, well, simply boring. This is ADHD. To imagine it is one thing, but to actually live this is a whole nother story. Thankfully, in 2017, there are various types of treatment that one can seek to make ADHD more manageable. Today, I'd like to present with you the options that are available and the benefits of seeking treatment if you or a loved one have ADHD. So what is ADHD? ADHD is attention deficit hyperactivity disorder. According to ADHD coach June Silney, it is a neurobehavioral disorder that interferes with the ability to stay on task and to also exercise age-appropriate inhibitions. Some of those symptoms include hyperactivity, inattentiveness, forgetfulness, lack of motivation, anxiety, restlessness, and impulsivity. These can be manifested in different ways. In children, they may have the lack of ability to sit still in class. They may be extremely talkative, turn in often incomplete assignments, and have long and frustrating homework study sessions. They can also exhibit in ways where they show social awkwardness due to their lack of emotional maturity to be able to notice social cues. In adults, they frequently, due to impulsivity, impulse shock creating debt, are always late, may experience multiple marriages in a lifetime due to ADHD symptoms, making it hard in a relationship, especially if untreated, frequently change jobs, experience obesity, incarceration, and sadly, substance addiction. There are two types of treatments that one with diagnosed ADHD can seek. You can do therapy, which includes group therapy, cognitive therapy, anger management, intervention, psychoeducation, and family therapy. In addition to therapy, or even independently, you can also request for medication from a doctor. They may prescribe a stimulant, which according to healthline.com would include dopamine, which is necessary for ADHD patients because they lack dopamine as a brain chemical. You can also acquire medications such as cognition enhancement and antihypertensive medication. So why is all of this important? Well, according to smartkidswithld.org, it shows that untreated ADHD patients are 100% more likely to experience substance abuse, and children with untreated ADHD are 58% more likely to fail school. Also, in contrast to that, a report in psychiatrictimes.com shows that a study done on those who were treated for medication showed in a 10-year span that 41% reduction of criminality for those that were untreated, and also versus those that were untreated. 7.1% of those that were treated also had a tobacco addiction compared to 19.6% of those who were untreated having a tobacco addiction. So, I would like to say that ADHD is a very personal issue for me. I have a daughter that has recently been diagnosed with ADHD over a year ago, and I have, through research, have noticed that a lot of the symptoms she exhibits were also symptoms that I struggled with in my childhood, self-diagnosing myself with ADHD. So I guess you could say I have a first-hand account of how it feels and the struggles experienced to be untreated versus the advantages that my daughter has as a treated patient with ADHD. I also would like to end with stating that ADHD is not a sentence of gloom. In fact, in 2017, it is very much so manageable. And I hope that this speech encourages those who have been diagnosed or who have loved ones who are diagnosed with ADHD to seek treatment and to stop the stigma of receiving mental health, in particular, help for ADHD. Thank you.